Before we dive into the specific symptoms, it's incredibly helpful to understand exactly what we're talking about. The prostate is a part of the body many men have heard of, but few could point to. So let's demystify it. The prostate is a small gland, typically about the size and shape of a walnut. It's a key part of the male reproductive system, and its location is the entire reason it can cause the issues we're about to discuss. Imagine your bladder as a small balloon that holds urine. Coming out of the bottom of that balloon is a tube that carries the urine out of your body. That tube is called the urethra. The prostate gland is wrapped snugly around the very beginning of this tube, right where it leaves the bladder. For a simple mental image, think of the prostate as a small donut, and the urethra passes directly through the hole in the middle. This location is everything. The prostate has two main jobs. First, it produces the milky white fluid that mixes with sperm to create semen, providing nourishment and a mode of transport. Its second job is muscular. It has fibers that help to forcefully propel semen out during ejaculation. It also acts as a valve, ensuring that urine and semen don't exit at the same time. It's a small but mighty gatekeeper, controlling the flow of crucial bodily functions. Now, here is the key fact that underpins our entire conversation today. The prostate has a unique life cycle. It grows to its normal adult size during puberty. Then, for many men, it starts a second growth spurt somewhere around middle age, typically after the age of 40. This age-related growth is a perfectly natural biological process, and it's the primary reason prostate health becomes such a common topic of conversation as we get older. This second growth is what sets the stage for the symptoms we need to pay attention to. Why do prostate problems become so common with age? So, if this growth is natural, why does it cause problems? The issue isn't the growth itself, but the consequences of that growth in such a crowded neighborhood of the body. There are three main conditions that account for nearly all prostate-related issues. Understanding the difference between them is crucial, as it helps to remove a great deal of fear and uncertainty. First, and by far the most common, is benign prostatic hyperplasia, or BPH. Let's break down that medical-sounding name. Benign means it is not cancerous. This is the single most important word to remember. Prostatic simply means it relates to the prostate gland, and hyperplasia is the medical term for enlargement or an increase in the number of cells. So, BPH is simply a non-cancerous enlargement of the prostate. This is the condition that affects more than half of men in their 60s and up to 90% of men in their 70s and 80s, according to the American Urological Association. Remember our donut analogy? With BPH, the donut simply gets bigger and puffier. As it expands, the hole in the middle gets squeezed, narrowing the path for urine. It's like gently stepping on a garden hose. The pressure is increased, but the flow of water is weakened and disrupted. The second condition is prostatitis. The itis at the end of a word in medicine means inflammation. Prostatitis is an inflammation or, sometimes, an infection of the prostate gland. It can cause swelling and pain, and it can affect men of all ages, not just older men. The symptoms can often mimic BPH, but they may also include pain in the pelvic area, fever, or a burning sensation during urination. It's a completely different issue from BPH, requiring a different diagnosis and treatment plan. The third condition is the one that worries people most: prostate cancer. It's true that this is one of the most common cancers diagnosed in men. However, there is a lot of reassuring news here that often gets lost. The vast majority of prostate cancers grow very, very slowly. Many men live for decades with slow-growing prostate cancer that never causes them any harm. And, most importantly, when it is detected early, prostate cancer is one of the most treatable forms of cancer with exceptionally high survival rates. The key is that BPH, prostatitis, and prostate cancer can sometimes present with similar initial symptoms. That is why it's so important not to guess, but to have a conversation with a doctor to understand exactly what is going on. Symptom number 1 and number 2, the frequent urge and nighttime trips, nocturia. Now that we understand the causes, let's figure out which signals from the body you need to pay attention to first. Perhaps the most common and earliest signs are a change in how often you feel the need to urinate. This can manifest in two ways: frequency during the day and waking up at night, a condition known as nocturia. You might find yourself planning your errands around the location of the nearest restroom or feeling a pressing urge to go again shortly after you've just been. This happens for a simple mechanical reason. The enlarged prostate, sitting right below the bladder, begins to push upwards on it. This constant pressure irritates the bladder wall and, crucially, reduces its effective capacity to store urine. Your bladder is a sensitive organ with stretch receptors that tell your brain when it's getting full. With the prostate pushing on it from below, these receptors are triggered much earlier. Your brain gets the time to go signal even when the bladder is only partially full. The result is that you feel the urge to urinate more frequently throughout the day, even if you're producing less urine each time. Then there is the issue of waking up at night, or nocturia. While getting up once during the night might be considered normal for many people as they age, waking up 2, 3, or even more times is a classic sign that the prostate is interfering with urinary function. This not only disrupts your sleep, but can have a significant impact on your energy levels and overall quality of life. The cause is the same as daytime frequency, but it's compounded by the fact that your body's natural rhythm for urine production changes at night. The constant battle to push urine through a narrowed urethra can also make the bladder muscle itself more irritable and overactive over time. If your sleep is being consistently fractured by trips to the bathroom, your body is sending you a very clear signal that the mechanics of your urinary system are being challenged. Symptom number 3 and number 4, weak stream and difficulty starting. The next set of symptoms relates not to how often you go, but to the process of urination itself. Many men notice a distinct change in the force and character of their urinary stream over time. This includes a stream that is noticeably weaker than it used to be, or one that stops and starts intermittently. Another related symptom is difficulty initiating urination, known medically as hesitancy. You might stand at the toilet for a moment, waiting for the flow to begin. This is where our garden hose analogy is most useful. The urethra, passing through the center of the prostate, is the hose. The enlarged prostate tissue in BPH is the foot that is gently but firmly stepping on that hose. Your bladder is a strong muscle, and its job is to contract and squeeze the urine out. When the pathway is wide open, this is an easy job. But when the urethra is compressed, the bladder has to work much harder to force the same amount of urine through a much narrower opening. This tremendous extra effort results in a flow that is weaker and less powerful. The stop and start stream happens because the bladder muscle may begin to tire during urination, unable to maintain the high pressure needed to overcome the obstruction. Hesitancy, that delay before the stream starts, occurs for the same reason. It takes a moment for your bladder to build up enough pressure to successfully force urine through the compressed zone of the urethra. Many men adapt to these changes so gradually over the years that they don't even realize how much their flow has diminished. They might subconsciously strain to urinate or find themselves taking much longer in the bathroom than they used to. It's a slow, progressive change, but it is a direct mechanical clue that the prostate is beginning to obstruct the urinary path. Symptom number 5 and number 6, incomplete emptying and dribbling. Following directly from the flow problems are the frustrating symptoms that happen at the very end of urination. These are the feeling of incomplete bladder emptying and post-urination dribbling. They often go hand in hand and can be particularly bothersome. The sensation of incomplete emptying is exactly what it sounds like. You finish urinating, but you still have a persistent, nagging feeling that there is more urine left in your bladder. This isn't just a feeling, it's often a physical reality. After fighting so hard to push urine past the obstruction caused by the enlarged prostate, the bladder muscle may not be strong enough to completely expel every last drop. A small, or sometimes significant, amount of residual urine can be left behind. This is what causes that sense of fullness and can contribute to you feeling the urge to go again just a short time later. Post-urination dribbling is a direct consequence of this same process. After you've finished, a small amount of urine can get trapped in the part of the urethra that was being squeezed by the prostate. Then, after you've zipped up and are walking away, this trapped urine leaks out unexpectedly. This happens because the pressure from the prostate prevents the urethra from closing off properly and being completely emptied by the surrounding muscles. This symptom can be both embarrassing and inconvenient, but it is, once again, a purely mechanical issue. It's important to note that consistently leaving urine behind in the bladder can create an environment where bacteria can grow, which increases the risk for urinary tract infections, or UTIs. While UTIs are much less common in men than in women, an enlarged prostate is one of the leading risk factors for them in older men. Symptom number 7, pain or blood in urine/semen, the red flags. The 6 symptoms we've just discussed are overwhelmingly caused by the benign, non-cancerous enlargement of the prostate. They are signals to have a conversation with your doctor. The final symptom we'll cover, however, falls into a different category. These are the red flag symptoms, and they warrant a more prompt evaluation. These are any kind of pain or burning during urination, a condition called dysuria, or the visible presence of blood in your urine, hematuria, or in your semen. Pain during urination is not a typical symptom of BPH. It more commonly points to an infection, such as prostatitis or a urinary tract infection. It can also be caused by bladder stones, which can form when urine that is consistently left in the bladder crystallizes. While these conditions are treatable, they require medical attention to resolve. The sight of blood, whether in the urine or semen, can be very alarming, and for good reason. It is never normal. While it can be caused by something as simple as a vigorous infection or a burst blood vessel on the surface of an enlarged prostate, it can also be a sign of a more serious issue, such as bladder cancer or a more advanced prostate cancer. The key thing to understand is that it's impossible for you to know the cause on your own. These are not wait-and-see symptoms. The presence of blood or significant pain warrants a prompt call to your doctor's office. The goal is not to panic, but to be proactive and allow a medical professional to investigate the cause and rule out anything serious. When is it officially time to see a doctor? With all these potential symptoms, the big question is, at what point should you actually pick up the phone and make an appointment? There isn't a magic number or a universal trigger. The answer is based on a few practical rules of thumb. The first and most important rule is the quality of life rule. The primary reason to seek treatment for most prostate symptoms is that they are bothering you. Are the symptoms starting to negatively impact your daily life? Are you turning down invitations for long walks or car trips because you're worried about finding a bathroom? Is your sleep suffering so much that you feel tired and irritable during the day? Is the inconvenience simply becoming a source of constant frustration? If the answer to any of these questions is yes, then it is time to see a doctor. You do not need to simply endure these changes as an inevitable part of aging. The second is the sudden change rule. Most symptoms from an enlarging prostate develop very slowly and gradually over months or years. If, however, your symptoms appear very suddenly or worsen dramatically over a short period of just a few weeks, this is a reason to get checked out. A rapid change could indicate something else is going on, like an infection, and it warrants a proper evaluation. Finally, there's the red flag rule, which we just discussed. To reiterate, if you experience any pain during urination, see blood in your urine or semen, or, and this is a true medical emergency, if you suddenly find that you are completely unable to urinate at all, you should seek immediate medical care. But for the more common, slow-onset symptoms, the guiding principle is your own well-being. When the problem starts managing you instead of you managing it, that's your cue to seek advice. Demystifying the doctor's visit, what to expect. Knowing you should go is one thing. Feeling comfortable about it is another. A lot of men delay seeing a doctor because of anxiety about the unknown or perhaps embarrassment. So let's pull back the curtain and walk through what a typical first visit for urinary symptoms looks like. The process is straightforward and designed to gather information efficiently and comfortably. The visit will almost always begin with a simple conversation. Your doctor will ask you to describe your symptoms in your own words. They'll want to know what you're experiencing, how long it's been going on, and most importantly, how much it's bothering you. They may even have you fill out a short questionnaire, often called the International Prostate Symptom Score, or IPSS, which helps to quantify your symptoms in a standardized way. They will also ask about your general medical history and any medications you are taking. This conversation is the most important part of the evaluation. Next comes the physical examination. This will typically include a brief check of your abdomen and, yes, the digital rectal exam, or DRE. This is the part of the visit that causes the most apprehension, but the reality is that it is a very quick, safe, and incredibly informative exam that lasts no more than 10 to 15 seconds. During the DRE, the doctor inserts a gloved, lubricated finger a short distance into the rectum. Because the prostate sits right up against the rectal wall, the doctor can easily feel its back surface. They are checking its size, its shape, and its consistency. They are feeling for any hard nodules or lumps that could suggest cancer, or for tenderness that might indicate an infection. It provides crucial information that no other simple test can. Finally, the doctor will likely recommend a couple of simple lab tests. A urine test will be done to check for signs of infection or blood, and a blood test to check your prostate-specific antigen, or PSA, level. PSA is a protein produced by the prostate gland. An elevated level can be a sign of a problem, but it is very important to understand that it is not a cancer test. PSA levels can be raised by BPH, by an infection, prostatitis, and even by recent sexual activity or a long bicycle ride. A high PSA is simply a signal that the prostate may need further investigation. It is not, by itself, a diagnosis of cancer. Your doctor will interpret the result in the context of your age, your symptoms, and the findings from your physical exam. Myth number 1. Prostate problems always mean cancer. Now that we know what to look for and what to expect at the doctor's office, it is essential that we clear the air by tackling some of the most common and dangerous myths surrounding prostate health. The single biggest myth, and the one that causes the most fear and prevents men from seeking help, is the belief that urinary symptoms are an automatic sign of cancer. Let's be perfectly clear, this is false. The statistical reality is that the overwhelming majority of urinary symptoms in men over the age of 50 are caused by the completely non-cancerous condition of benign prostatic hyperplasia. As we mentioned earlier, medical data shows that more than half of all men will have BPH by age 60. Prostate cancer, while common, is significantly less prevalent. To assume that a weak stream or nighttime bathroom trips means you have cancer is like hearing hoofbeats and assuming it's a zebra instead of a horse. It's statistically improbable and leads to a great deal of unnecessary anxiety. The PSA test misconception is a big part of this myth. Because it has become so well known, many people believe a high PSA equals a cancer diagnosis. As we've established, this is not true. Your PSA level can be elevated for many reasons. In fact, a very large, benignly enlarged prostate gland will naturally produce more PSA, leading to a higher reading in the blood. An inflamed or infected prostate will leak large amounts of PSA into the bloodstream. An elevated PSA is simply a piece of the puzzle. It tells your doctor to pay closer attention, but it does not provide a definitive answer. The most important takeaway here is that thinking of these common urinary symptoms as an automatic cancer sentence is not only incorrect, but it's also harmful. That fear can cause men to ignore their symptoms, hoping they will just go away. This delay prevents them from getting simple, effective treatment for a very manageable condition like BPH, and in the rare case that something more serious is present, it delays the early detection that is key to successful treatment. Myth number 2. Natural supplements like saw palmetto will cure BPH. The second major myth we need to address is the promise of a quick fix from the supplement aisle. You have undoubtedly seen the advertisements online, in magazines, or on television for supplements. Most famously saw palmetto, that promise to fix your flow and end your nighttime trips naturally. It is a multi-billion-dollar industry built on this promise. The question is, does it work? This is an area where we must listen to science over marketing. When a new drug is developed, it has to go through rigorous, large-scale, placebo-controlled clinical trials to prove that it is both safe and effective. Many of these popular supplements have been put to the same test. Major, high-quality scientific studies, including several large trials funded by the National Institutes of Health, have been conducted to see if saw palmetto is truly effective for BPH. The results, published in top medical journals like the New England Journal of Medicine, have been consistently clear. Saw palmetto has been shown to be no more effective than a placebo or a sugar pill. Men who took the supplement saw no more improvement in their urinary symptoms than men who took a pill containing no active ingredient. The danger here is not necessarily that the supplement itself is harmful, although the industry is poorly regulated. The real risk is one of delay. A man who is experiencing bothersome symptoms might choose to spend months or even years trying various supplements, believing he is actively treating his problem. During this time, his symptoms may worsen, and more importantly, he is delaying a proper medical evaluation that could provide an accurate diagnosis and access to proven, effective treatments. Relying on an unproven remedy can mean you miss the window to easily manage a condition that is affecting your quality of life, or in a much rarer scenario, to diagnose a more serious problem at its earliest stage. Myth number 3. Having prostate surgery means the end of your sex life. Another significant fear that holds men back is the belief that any kind of prostate procedure, especially surgery, will inevitably lead to permanent erectile dysfunction or incontinence. This is a powerful myth, often rooted in stories from decades ago when treatments were indeed more invasive and less precise. It's crucial to understand that medicine has advanced dramatically. The old reputation of prostate treatments still causes a lot of fear, but it's no longer reflective of today's reality. For BPH, the most common surgery is a procedure called a TURP, or transurethral resection of the prostate. This is done with an instrument inserted through the urethra. There are no external cuts, to remove the inner part of the prostate that is blocking the urine flow. Think of it like scooping out the pulp of an orange while leaving the peel intact. This procedure takes place far from the nerves that control erections, which run along the outside of the prostate gland. Furthermore, there is now a wide array of minimally invasive options that are even less disruptive, such as laser procedures that vaporize the obstructing tissue or implants like the UroLift system that simply hold the prostate tissue back. For prostate cancer, the advent of nerve-sparing robotic surgery has revolutionized the field, allowing surgeons to remove the cancerous gland with incredible precision, with the primary goal of preserving the delicate nerve bundles essential for erectile function. Let's be honest, are side effects still possible? Yes, but they are far less common than they once were. and they are often temporary. Many men experience a full return of function. It's also important to consider the other side of the coin. For men suffering from severe urinary symptoms, the constant discomfort, lack of sleep, and anxiety can already have a negative impact on their sex life. In many cases, successfully treating the underlying urinary problem can lead to such a dramatic improvement in overall well-being and confidence that it has a positive effect on their intimate life. The key is to have an open conversation with your urologist about the risks and benefits of each specific option for your unique situation. An overview of modern treatment strategies. So, if supplements aren't the answer and surgery isn't always the first step, what does modern treatment look like? The good news is that there is a wide spectrum of options, and the approach is almost always to start with the least invasive choice that will effectively manage your symptoms. For men with mild symptoms that aren't really bothering them, the best course of action is often something called watchful waiting or active surveillance. This means you and your doctor simply monitor the situation with regular checkups. No active treatment is needed. You might be given some simple lifestyle advice, like reducing caffeine and alcohol intake in the evening, but that's it. It's a recognition that not every symptom needs a prescription. If symptoms become more bothersome and start to impact your quality of life, the next step is typically medications. There are two main classes of drugs that are highly effective for BPH. The first are called alpha blockers. These drugs don't shrink the prostate. Instead, they work by relaxing the smooth muscle cells around the neck of the bladder and within the prostate itself. This relaxation opens up the urethra, making it easier for urine to flow. Think of it as telling the foot on the garden hose to ease up a bit. The second class of drugs are called 5-alpha reductase inhibitors. These medications work differently. They actually block the hormonal process that causes the prostate to grow, and over a period of several months, they can cause the prostate to slowly shrink in size, providing long-term relief. Finally, for men with more severe symptoms that don't respond well to medication, or for those who prefer not to take daily pills, there are minimally invasive procedures and surgery. As we just discussed, these options have become incredibly sophisticated. From laser therapies that vaporize tissue to the traditional and highly effective TURP, the goal is always the same: to physically remove the obstructing prostate tissue and restore a wide-open channel for urine to pass through. These are reserved for when the mechanical problem requires a mechanical solution, and they can provide a profound and lasting improvement in quality of life. Prevention and lifestyle, what you can control. While you can't change the fact that your prostate will likely grow as you age, there is growing evidence that certain lifestyle choices can support overall prostate health and potentially reduce your risk of developing more aggressive problems. These are things that are entirely within your control and benefit your entire body, not just your prostate. First is diet. There are no magic foods, but the principle is simple. A diet that is good for your heart is also good for your prostate. This means a diet rich in fruits, vegetables, and healthy fats, and low in red meat and processed foods. Some specific nutrients have been highlighted in research for prostate health. Lycopene, a powerful antioxidant that gives tomatoes their red color, has shown some promise. It is best absorbed by the body when tomatoes are cooked, so tomato sauce and paste are excellent sources. Cruciferous vegetables, like broccoli, cauliflower, and kale, also contain compounds that are believed to be beneficial. Healthy fats, like those found in avocados, nuts, and olive oil, are preferable to saturated fats. Second is exercise. Regular, moderate physical activity is one of the best things you can do for your health. Exercise improves blood flow, helps you maintain a healthy weight, and can reduce inflammation. Studies have shown that men who are more physically active have a lower risk of developing bothersome BPH. Being overweight is a known risk factor for developing both BPH and more aggressive forms of prostate cancer, so even simple activities like a brisk daily walk can make a real difference. A final tip is to consider your fluid intake. It may seem counterintuitive, but don't drastically cut back on water to reduce urination. Dehydrated, concentrated urine can irritate the bladder and make the urge to go even stronger. It's better to stay well hydrated throughout the day, but perhaps taper off your fluid intake in the 2 to 3 hours before you go to bed. This simple timing adjustment can sometimes make a significant difference in how many times you have to get up at night. Conclusion: your health is a dialogue, not a verdict. We've covered a great deal of ground today, from the basic function of the prostate to the specific symptoms, the myths, and the modern treatments. If there is one central message to take away from all of this, it is that knowledge defeats fear. The urinary changes that happen with age are common. They are usually not caused by cancer, and they are highly manageable with the help of modern medicine. Ignoring these signals from your body because of embarrassment or anxiety is the only wrong move. The main conclusion we can draw is this: your health is in your hands, and it depends not on following myths, but on timely dialogue with a doctor. Remember that many age-related changes are not a verdict, but a medical problem that has a solution. You do not have to plan your life around the nearest bathroom, and you do not have to accept poor sleep as your new normal. Taking care of yourself based on knowledge, not fear, is the most reliable strategy for a long, healthy, and fulfilling life. If anything we have talked about today sounds familiar, I encourage you to see it not as a cause for alarm, but as a reason to start a conversation. That conversation is the first and most powerful step you can take.